I'm going to talk about what is long COVID. We have heard so much of this term over the past 1.5, more than 2 years now. So, long COVID is something, when a patient has COVID and has multiple issues and it's been like more than 4 weeks, 6 weeks, the issues that the patient has could be balance issues. Patients are, having some chest pains, difficult to breathe, they're getting fatigue after walking short distances, and other issues. The role of physiotherapist is very important in long COVID. So let's talk about therapists who are trained into pulmonary rehab. So we call it cardiopulmonary rehabilitation. So the initial assessment is done on these patients having long COVID. So we sort out what are the issues. Like I said, all the issues which I just mentioned. So a patient will look into patients having balance issues. There are particular exercises or regimes that the patient has to follow. A patient has to do a vigorous chest physiotherapy program wherein patient has a lot of pooled in secretions and there's difficulty to breathe. So there's a proper drainage positions that we teach the patient in a proper positioning while lying down, getting up, and there are other areas to be looked into in the lungs part. And there are other issues like walking issues, gait disturbances. Patients get fatigued very easily. So there is a proper pulmonary rehabilitation that has to be taken care. There is a proper conditioning that has to be done by the physical therapist. We have a whole lot of program that sets in. So this can be done in the hospital of any of the max hospitals, or this can even be done at home by our therapists who actually go home, because there is fear in the patients. So I can even talk about patients having stress related issues. So these therapists, they actually look into those areas also. Sometimes you have to gain confidence of the patient so that he can actually get back to his community. So the therapist looks into all these aspects, and a proper training program is formulated by the therapist, and it's been reviewed weekly, 10 days, and of course after discussion with the referring doctors, consultants, the program has been made and then reviewed and followed gradually.
Like and follow our page for the latest healthcare updates.